The number of cases from what North Korea is calling fever increased by more than 174,000 on Friday, according to North Korean state media, who reported more than 20 deaths from what has been proved to be a devastating COVID-19 outbreak. Leader Kim Jong-un reportedly called the situation the greatest turmoil the country has faced. Will Ripley has more.
It was just a matter of days ago that North Korea didn't even have one officially acknowledged case of COVID-19 for the entire pandemic. A lot of outside experts doubted whether that was the case, but it was certainly significant and troubling to see North Korean state media on Thursday publish news of their first confirmed case of COVID-19, or at least first reported case. And then one day later, 350,000 cases. A number that many outside observers fear is going to rise and potentially rise quickly. Because if indeed it is the highly contagious Omicron variant spreading through North Korea, this is one of two countries in the world, the other being Eritrea, where they never vaccinated anybody. Nobody in the general public has gotten the vaccine. The World Health Organization apparently did offer to send millions of doses of certain vaccines to North Korea, and Amnesty International says they refused. Maybe they wanted different vaccines. Who knows what the rationale was, but as a result, nobody in the public, the general public of North Korea, has gotten a vaccine, which means there's no herd immunity. And there are a lot of people who are food insecure. Almost half the population, or some 40% of North Koreans, don't have a nutritious diet. So you combine that with a highly contagious, potentially variant of COVID-19, and you have what could be a catastrophe, compounded by the fact that North Korea has a dilapidated healthcare system. They don't have ventilators, and the kind of things that were used to treat patients in the United States, the wealthiest country in the world, which lost 1 million people to COVID-19 at least, so far. And the North Koreans, even though their country is much smaller, they could easily lose a huge portion of their population if this thing spreads out of control, and they have no way to treat people.